By trade, I'm a kidney doctor, and I've had the privilege of leading a coalition of the willing. So Green Nephrology, we lit a touch paper, and we built the stadium, and the crowds came, and they've done fabulous things within the kidney world.
The NHS has a target of 80% carbon reduction by 2050. And that means big savings from the 16% spent on transport, 19% on building energy use, and the 65% spent on purchased goods and services. But can it be done? The example from nephrology is very encouraging.
Dialysis is a very energy and resource demanding treatment. We use lots and lots and lots of water, extremely high quality water. Traditionally, it goes down the drain. And now in our dialysis units up and down the country, that water treatment is going into the grey water areas of the hospital, turning off the computers at night, putting the waste in the right bin. Use the wrong bin, costs are 5 times, 10 times more expensive in terms of waste disposal there. Every encounter with the environment counts.
The challenge is to reduce the carbon footprint of the health service by 80%, and simple operational efficiencies can only get us so far. So at some point we need to look beyond those to much more transformational changes to the model of care itself, to take much greater advantage of what patients can bring to their own care. An example in kidney care is Renal Patient View, which is a web system whereby patients can access their own blood results between clinics. And this gives the opportunity for patients to be much more active partners in their own management and preempt complications.
Well, in terms of the environment, one of the huge factors that contributes to the National Health Service's 3% of carbon footprint of the UK, which is what they are. One big aspect of that is transport, patients travelling to and from the hospital, the doctors as well to some degree, but patients in particular. So anything that you can do that reduces the need to visit the hospital reduces that aspect of the carbon footprint. So with Renal Patient View, because you get your results online in the convenience of your own home or wherever you happen to be, it means you can check them much more frequently, and you spot earlier the kind of things that might hint that something is going wrong or needs to be changed, and so you can act to remedy that in such a way that may well prevent you having to visit the hospital or even become an inpatient for several days, which again is a big impact.
The key initiative taken by the Centre for Sustainable Healthcare was the establishment of a fellowship programme to enable doctors to study and evangelise new models of sustainability.
Green Nephrology was the first of these programmes where we really pioneered the concept very successfully, and we had a terrific fellow in Dr. Andy Connor in 2009-10. And one of the important roles is to draw out examples of innovative practice that might already be out there, but which aren't taken up more broadly. For example, the laboratory screening programme introduced in Birmingham. And the idea is to take existing routine lab results that are passing through the lab on a daily basis, and to make sure that we're picking up those patients whose kidney function is declining at an early stage when treatment can be much more successful and simpler. And this programme's been very successful so far, led by Dr. Hugh Rayner and colleagues such as Dr. David Kennedy.
We estimate that renal replacement therapy costs around £30,000 per patient per year, and therefore a screening programme such as ours can reduce that for a hospital by maybe 10 patients. That would be a considerable saving to the healthcare economy.
So we know what to do, I think. We know that it's worked really well. We've got this fantastic model that's shown real benefits for everybody involved. And all we need to do now is replicate that in 35 specialties in medicine. But we don't want each one to take 2 or 3 years to get the funding for. That's the thing. We could do them all now. We know what to do.
Well, we at the Centre for Sustainable Healthcare were aware that the examples we were documenting in the Green Nephrology case library were showing tens of thousands of pounds a year saving, many of them. And we wanted to work out if we were to implement those examples systematically across the kidney service, so in all the examples in many different units, how much could be saved. And we calculated that the average unit could be saving somewhere between £150,000 and £200,000 a year.
So if you scale that up to what could be done if we did reasonable things that we've been able to achieve in a high proportion of the kidney units, do them across all the kidney units and take the same kind of approach across the whole health system, then there's at least £1 billion that we could save. I'll say tomorrow, but maybe next Tuesday is the time to start. It doesn't cost more to be sustainable, it costs less, it keeps people happy, it contributes socially to the environment, and it contributes to the overall well-being of our communities.